The current healthcare system isn't working for our members, our retirees, or for that matter, our employers. But the problems are just too big to solve at the bargaining table. We need to reform the system to get healthcare we can all count on. This is only going to happen if we build the power to elect the right leaders and then hold those leaders accountable.
Most people are just one big illness away from bankruptcy.
It's been really hard lately, the amount of layoffs that we've been having, retirees, benefits. No matter what happens at the bargaining table, we can always lose that by the stroke of a pen.
Now's the time for change. We have the opportunity not only on the health care issue, but for the Employee Free Choice Act, as well as trying to get the change in our presidential election. So
when we work at bargaining, it's just not for our members. It affects the whole nation, all workers. So a lot of people really think that as workers for a union, we're just fighting for us, but we're actually fighting for all workers.
We're actually getting together, people from different districts, to start a campaign to encourage not only CWA members, but also take it all the way up to Congress.
You know, right now our biggest, especially in my generation, we need to look more into our retirement and making sure that we have the proper benefits that's going to be set up for us, where our retirees right now, you know, I'm fearful for them, so it's important that we all bond together and make sure that we have what they've given us. I mean, they set the stone for us. We need to continue that.
Hello. I'm Annie Hill, Executive Vice President of the Communications Workers of America. Healthcare reform is one of the most important issues facing CWA members today. Most of us have great healthcare coverage through our employers, but with the ever-increasing costs, it is harder and harder to maintain high-quality care for our members. This is a problem that we cannot solve at the bargaining table. We need to find solutions that will preserve healthcare benefits for members and retirees alike, without putting financial strain on our employers. That's why we're undertaking a nationwide campaign to fix our broken healthcare system. Many groups are talking about healthcare reform, but not all of the reform proposals are the same. In order to effectively address the issues facing CWA members and the rest of the country, our healthcare system must cover everyone. It must control costs. The government must play a strong role in setting and enforcing policy. It must improve the quality of our health, and it must have broad-based tax financing. We have our best opportunity in years to take a big step towards fixing the system by electing leaders at every level of government who are committed to CWA's healthcare principles. Together, we can bring about real healthcare reform. In 2008, it's more important than ever for every CWA member and retiree to help elect leaders who will stand up for our principles.